private healthcare group MediClinic has launched an independent audit. It comes after allegations of manipulation of patients' bills to save the group's bottom line. An employee of MediClinic blew the whistle on this manipulation claims. For more on this reaction, we are now joined by South African Medical Association chairperson Dr Mvuyisi Mzukwa. Doctor, thank you so much for your time this evening. So, Doc, what are the core ethical principles that healthcare providers are expected to uphold, particularly in terms of billing and coding practices?
Good evening to you, to you and your viewers, and thanks for having me. Obviously, we are dealing so far with what is said to be allegations.
Yes.
But I think, yes, and I think we have that context so far. And our comment will really be restricted to what is available in the public domain. But it is important because it's an important matter in the healthcare sector. You will understand that as a system, there's a lack of trust. There's between patients and the healthcare system. Obviously now between the private sector and its users. So it is important that we look at that. And we know that, we're supposed to be transparent in how we deal with patients. We are supposed to be, in fact, there should be some training, what we call ethics education and training. That should be happening at that level so that everybody knows exactly what is happening here. Because they need to be transparent in terms of dealing with patients. They need to be approachable. They need to be beyond the reproach, in terms of, corruption and stuff like that. The implications that we are facing, with corruption. So those issues, they need to be stressed. There needs to be an investment in the healthcare sector in terms of ethics training and education.
Speaking of that, Doctor, from a legal perspective, what regulations and laws govern billing practices and clinical coding accuracy in the healthcare industry?
Well, if you look at first of all, if you look at the system itself, there is a breakdown in terms of, monitoring of the system, because healthcare professionals are monitored in terms of their behavior and conduct by the HPCSA, and nurses are obviously by their council, nursing council. Everybody, pharmacists with their pharmacy, but when it comes to hospitals, there is no regulatory body that goes, that monitors the hospitals. I'm talking now about private hospitals and private groups. So that is a gap, in terms of the regulatory environment that needs to be attended to by government and by the healthcare sector as well. I know that on the side of government, they've been trying, they came up with what they called a healthcare sector anti-corruption forum, where they are looking at dealing with issues of corruption in the healthcare sector. But when it comes to this, there is nothing that is dealing, because when you take these guys to task, you want them to account, you need to have a regulatory framework that you are going to refer to them. But at the moment, there is nothing. That with medical aids, you run to the Council for Medical Schemes, but with hospitals, there is nothing. So we need to fill that gap, making sure that everybody can account to someone somewhere, especially we're going to the issues of NHI. So it is important as a country to be looking at everyone. Everyone must account, not only practitioners, not only nurses, not only schemes, but also institutions, healthcare facilities themselves.
Most certainly. Can you explain the potential legal consequences and liabilities that healthcare providers could face if found guilty of manipulating patient bills for financial gain?
You must recall that this is really not, the allegations are really against practitioners. It is against the institution itself, the hospital group. And, there's many things that can be done there. You have the medical schemes, that are the custodians of the funding industry, that they should be looking into this matter on a serious note. They need to investigate this incident. It can't be that at this point in time we allow MediClinic to investigate itself. I've never seen any thief investigating himself. I'm not saying that they are thieves, but I'm saying, I'm just making an example to say you will need somebody from outside, and people that have got an interest in this are the funders, and the funders must not only target the small fish like practitioners and stuff like that they've been doing in the past. Now they are facing with the big guns like MediClinic. They need to show consistency. They need to run after them. They need to have their forensic unit must come up and collaborate and investigate. Because, in healthcare, this is, to me as a practitioner, as a clinician, these are just symptoms, signs and symptoms of corruption. So if I see some signs and symptoms, then I want to investigate. And when I investigate, I need to see, one, to make a diagnosis that this happened, corruption really happened or not. And the other part of the investigation is the extent of that corruption. And then there are consequences to that, because we need to manage that. But like I said, if you're dealing with, as a clinician, I do prevention and cure. So in this case, as I said in the beginning, there needs to be training on the other side, ethics training and education, but also there need to be a regulatory body that manages this going forward.
Doctor, I can imagine with a lot of people who are listening to us right now, the allegations are between MediClinic and, of course, the medical aid schemes that they are claiming from. But many patients could be asking themselves, how does this directly affect them? How might patients be directly affected by that inaccurate billing and manipulated clinical coding?
It has a huge implication in terms of the premiums. Because if there's a waste, fraud and abuse in the system, that will take up the premiums, in the coming years. So we're complaining of a healthcare system that is expensive. It is expensive because there's abuse, there's fraud. It has a serious economic implications to the patients and to the country as well. Because if we're talking about a rise in cost and people who cannot access healthcare, we're talking about these barriers, that are caused by the system itself. So there are serious implications. People should be worried about corruption and should report corruption whenever it raises its ugly head.
If proven true, what could an institution such as MediClinic do in order to regain the trust of those that they serve?
Well, I think they need to first, if there's an investigation, they need to comply. Secondly, they need to come up, with a report. Talk to the public, and tell us what really happened around this. It wouldn't be enough to defend, their skin and say, no, actually, we are a reputable organization. But if something is found, we are going to deal with that decisively. That is not enough. There needs to be questions, there needs to be answers, there needs to be transparency, and people need to subject themselves for investigations. If they are clean, then they have nothing to worry about. They just have to present themselves for investigations or even invite that investigation. But what I'm saying is, it can't be that MediClinic is going to investigate itself. Medical aid schemes, the funding industry, is the one that must institute that investigation. And it must be independent. It must tell us what happened. As practitioners, we are also interested because lots of money is going through the system, and we didn't know why the medical aids are rising, costs are rising like this. And now we can see the signs and symptoms and the reasons why behind this rise in the premiums of medical aids, and the reason why many people cannot afford, to have medical aids. It's because of this rising costs.
I mean, with some of the allegations that the whistleblower made, who is known to News 24, were things like patients that could pass away in the emergency room are then claimed to have passed away in ICU, and I can imagine that the cost of passing away in these two places would be very different. One highlight of the sensitive aspect of these allegations, which the medical aid schemes are really keen and really want to know more on, is the alternative reimbursement model, the ARM. Could you explain to us how that system works?
Well, in that system, you don't. It's not like you pay for the. It's different because in other areas. You just do a procedure and you pay for that. You do another procedure, you pay for that. So there's separation of payment for it. But in this system, if a person is getting in there, it will be known when is this patient going to theater, going to an ICU and stuff like that. And then, regarding that, let's say it's a broken leg. It will be all the procedures that are going to or anticipated to be done in that broken leg, and then an amount of money will come out of that anticipation. So if it's not like you are going to charge for individual procedures, you just clump them together and pay one fee. So it is done to discourage, over servicing of patients and doing unnecessary things. So that's why they've got that lump sum.
Lastly, Doc, what measures could the healthcare industry take to prevent and deter manipulative billing practices in the future?
Like I said, the institutions themselves, they've got a burden, of training and educating their staff. Not only the staff, but, from the management level. In fact, all levels, there should be that ethics training and education. But also, like I said, on the side of government, we need to strengthen that or even create that regulatory body that is going to look after the performance and accountability of hospitals, private hospitals, because it can't be that they just do as they wish, and there's no one who can talk to them. They cannot account. So we do need to have that in the future. But also institutions like the one that I've mentioned earlier on, the health sector anti-corruption unit. We need to zoom in these institutions and find out, if there are complaints that are brought to the attention of these institutions. It must be that they are investigating, and those reports, they need to be made public, to bring back the trust, to communities, to say that if I am wronged by an institution, somebody is going to take them to task, and they are going to be investigated. And that report is going to be known to all of us.
Well, we certainly do look forward to the outcomes of this investigation. Thank you so much for your time and for your inputs this evening. That was South African Medical Association Chairperson, Dr Mvuyisi Mzukwa.